All right. Good afternoon, everyone. This is Dr. Okoro. I'm a double board certified plastic surgeon here in Atlanta, Georgia. I'm at GeorgiaPlastic, and we are live to answer any questions anybody would have about any topic in plastic surgery because that's what we do, plastic surgery. So, um,
So we have a few questions.
we have a few questions. What's the first question?
Okay, how long are patients in the recovery room after surgery?
That's a great question. So our surgical center is fully accredited by uh, double uh, ASF. We are nationally licensed and accredited, so we have to observe each patient, make sure that they meet our discharge criteria before they're discharged. So everybody's different, but an average of 45 minutes to an hour for most patients. So we will only discharge you when you're ready to go home with your family or your friend or your nurse. Some patients require post-op nursing by post-op care by a nurse.
Okay.
Next question.
How soon after surgery can you expect to return to work?
That's also a very common question in our practice. It really depends on the kind of surgery that you're doing. So if you're doing a breast augmentation, most patients will take about 3 to 5 days off. The same for liposuction. If you're doing a Brazilian butt lift, which is very common here, we ask our patients to take about a week off. If you're doing tummy tuck, we want you to take about 2 weeks off. So it all depends on what you're doing. Then if you're doing a combined surgery like a mommy makeover, 2 to 3 weeks off, depending on what you're doing. Everyone is different. The only way to really know what is good for you or what you need is to do a consultation. There's no one procedure is alike. Everyone they recover differently. Next question.
How much fat survive after a BBL?
So the national average about 30 to 40% loss. So you will lose about 30 to 40% of the fat that we put in. Most of those fat that you retain, about 60 to 70%, will last for, nothing is forever, but last for a long time. And another common question is, how about if I lose or gain weight? Remember, the first thing that we do with doing Brazilian butt lift is to sculpt the patient, give you a very nice shape. So your shape will be maintained whether with weight gain or weight loss. So the shape that will keep you in is what you stay, unless you gain excessive amount of fat, which we don't want you to. Okay, that's pretty much how that's done. Next question.
How long do you have to wear your compression garment?
Another excellent question. How long should you wear your compression garment? We place our patients on the post-op garment for about 4 to 6 weeks. Some people wear longer than that, but the average is about 4 to 6 weeks. So as I'll say, 2 months is a good time. And some people have more swelling than others. If you're in that category, maybe 3 months, but the average is about 4 to 6 weeks. Next question.
How soon after surgery can you start working out?
Wow, that's awesome. Like this. All right. It all depends on what you're doing. So if you have breast augmentation, you may want to take 1 to 2 weeks off, depending on the kind of workout you do. Liposuction, most of my liposuction patients go back to work in 2 weeks. Working out in 2 weeks. Tummy tuck, 4 to 6 weeks. Brazilian butt lift, most people take about 2 to 4 weeks off before they start working out, depending on where you're starting from. If you've never been to the gym before, though, before you see me, that might be longer. Just wait until you heal completely before you go to the gym. Because some people have never been to the gym before, or maybe they have, but they don't really go to the gym. They went to the gym, and now they want to go to the gym after their plastic surgery procedure. Just wait until you heal before you go back to the gym.
Next question.
Next question.
What are your post-care for your surgery patients?
We have an excellent post-operative care for our patients. So it's so extensive, I don't even know where to start. But let me just try. So the way we take care of patients after surgery is that I think that's what separates us from the crowd. Um, One day after your surgery, depending on the kind of surgery that you're doing, we will see you in the office the next day. Like the tummy tuck I did yesterday with the BBL, I saw the patient here this morning, make sure everything is fine, make sure she's have good fluid management, and then we'll see you again within a week and make sure that everything is healing well. There's no infection or anything like that. And then after the first week, we'll send you to our spa, our med spa. It's called a Machi Med Spa, where you do your lymphatic massage and all kinds of treatments there on a weekly basis. Depending on the package that you receive during your surgery, those are all included in your package every week. And then we'll bring you back about 1 month to see me after 1 month after your surgery. We'll examine, make sure things are healing very well. We may recommend or change your package at the spa. Make sure your garments are fitting well. And we'll send you back to the spa to continue for the next 6 weeks. And after that, we'll see you at 3 months, 6 months, 1 year, and we'll see you every year for the rest of your life. That's all included, by the way. Let me say it again. Every year for the rest of your life. That's what we do. Nobody else does that. That's what we do. I mean, this is just the overview. Included with that is we also include all the medications that you need, your garments, and the wonderful staff that we have here. You can't buy that anywhere. That's our post-op management.
Okay, so we have someone said that they live in Philadelphia, and would it be smart to come out to Atlanta to have surgery?
So that's a very good question. As you know, plastic surgery is going global. At any given time in our practice, like this morning, I saw 2 patients from Virginia. They flew in. So it is worth it. Atlanta is like the place to be. Our airport is international, so we have patients from anywhere in the world. Yes. So the answer is yes. We actually have a special section in our practice. All they do is out-of-town patient. We call it out-of-town program. Chelsea is in charge of that. So when we call the practice, we start with a virtual consult. So we get this worked out. So the first thing is book a virtual consult, which we do with either Skype or FaceTime. So once the appointment is booked, we'll contact you, set up a time. It's like a regular consult. I'll be on video with you just like this. We'll take a look at your picture, use your camera to examine your body, give you an estimate right there. If that's worth it, we're gonna bring you to Atlanta. I mean, you pay for the tickets, by the way, though. There's so many airlines that fly to Atlanta. Delta Airlines, this is their headquarters, and from here to anywhere, most places in the world is non-stop. We'll see you in the practice a few days prior to your surgery. Make sure everything checks out. We'll do your labs, do your evaluations, and boom, you have your surgery. Depending on the kind of surgery that you have, you may be here for about 2 weeks, 1 to 2 weeks, depending on what we're doing. The bigger the surgery, the longer you have to stay here. And after that, we can do some of the virtual follow-up, and then we'll see you as needed. What's the next question online?
Someone want to know, do you do mommy makeovers?
Yes, that's what pays the bills around here. Mommy makeover. So we call it the new ultimate mommy makeover. This ain't your grandmother mommy makeover we're talking about. So what is the new mommy makeover? In the 90s, it used to be the breast and the tummy. Great. So we still do those. The new mommy makeovers now are breasts, body sculpting, and BBL. So that's what pays the bills around here. Mommy makeovers, that's what pays our salary, okay? So we wrote a book on the new mommy makeover. Let me take this even further. How about the non-surgical mommy makeover? Somebody will say, what is that? So in our medical spa, we have all kinds of stuff that we can package together for those people that don't want any surgery. This is not for everybody. This is the latest and greatest non-surgical mommy makeover. We can start from the face, the breast, the tummy, the back, the thighs. What is mommy makeover? Is when you combine 1 or 2 procedures. So mommy makeover is in town. What's next?
The starting rate for a mommy makeover.
Well, what are we talking about? What does it cost? It really depends on what you're doing. The plastic surgery is not like going to Best Buy and buying a TV or video camera. It's not. One price doesn't fit all. Everyone is different. So somebody's mommy makeover could be facial rejuvenation and breast, or another person could be breast and tummy, or tummy and BBL. So it's all the price everywhere. The only way to really know what your cost is to get a consultation. What a consultation does is it gives you an idea what you need, how much it's going to cost for you, and it prepares you to save. So even if you're not ready right now, at least you have an idea what you need. I just saw a patient this morning that I saw about a year ago. She came in for butt implants. She's had a Brazilian butt lift. She didn't have enough fat for somewhere else, and we do butt implants. Not a lot of people know how to do butt implants well, so she brought in her quote. We honored the quote from a year ago. We don't always do that, but it was still consistent with what we offer now. So now she's saved up her money, and she will do her butt implant in a few weeks. So it all depends on what you want.
Okay, so that's it with the questions. You have patients to go see now.
Yeah, I gotta go see patients. Am I gonna come back at live again today?
Hey, if you want to come back.
All right. Well, thank you. If you have any more questions, feel free to send them to us, and I will answer them after my consult. I have some consults and some pre-op to see. Thank you for watching. Bye-bye.